Hello friends, welcome back. My name is Dr. Vijay Bhatia and today we are going to talk about other somatoform disorders. What are the other somatoform disorders? Any other disorder of sensation, function and behavior not due to physical disorder, which are not mediated through the autonomic nervous system, which are limited to specific systems or parts of the body, and which are closely associated in time with stressful events or problems. So what are we talking about here? So in this case, what happens? The patient comes to the doctor or complains to any other person about specific systems or parts of the body, and on examination or investigation there is nothing wrong. There is no physical disorder that will justify the continued presence of the complaints by the patient, and these are not related or mediated through the autonomic nervous system, like it is nothing to do with the cardiovascular system as we discussed in other somatoform disorders, and it is nothing to do with either specific organ either. So what happens is the patient complains about this problem. Let's take an example. The patient is complaining that there is something in my throat. I cannot swallow, as if there is some lump in my throat. I cannot eat food. I cannot drink fluids. So there is something wrong in my food pipe, in my throat, where I cannot take anything in. And this symptom has been present for some time, a long time, and on investigations we do not find any problems either with the stomach or musculature or with the food pipe, and we don't see any particular reason why this person can't swallow, and this person is complaining that there is a lump in the throat. So what happens is then we try to look at what could be the cause of that. And a lot of the time when you look at the relationship with the environment and with the people, we find there is some kind of psychosocial stress. And this stress could be between relationship, financial, work, stress from any other surroundings, which is possibly contributing and maintaining the symptoms the patient is complaining. And in return, what is happening is the patient is getting some kind of attention and some kind of support, either from the medical people or from the financial council, either with disability allowance or support from the community services or the third sector, or from their loved ones or the people who are they having conflict with in the first place, that is contributing towards their psychosocial stress. So this person is benefiting one way or the other from these investigations, from these complaints in a way, and repeated reassurances from the doctors, investigation specialists do not find anything. And in this particular situation, we were talking about Globus Hystericus, when the person is complaining about having difficulty in swallowing. But these can happen in other areas. This is in contrast to the multiple and often changing complaints of the origin of symptoms and distress found in somatization disorder. So what happens in somatization disorder, although the person have complaints and there's a psychological stress and the person in return gets attention. However, the complaints here are related with some kind of cardiovascular system, genitourinary system, or respiratory system. So there are a number of symptoms or complaints, either my chest pain or palpitations, or you are having stomach problem, too much bloating, too much discomfort, too much gas, or there are other symptoms with the respiratory system, I can't breathe properly. So there are a number of symptoms. In contrast to somatization disorder, in specific in this like Globus Hystericus, they are related to one particular system or organ, and they are very much focused with that. And remember, there is no tissue damage. So either in somatoform, other somatoform disorders or somatization disorder, there is no tissue damage. Any other disorders of sensation not due to physical disorders. So what we are talking about is any sensations. Remember my video on perception, sensation. We are, in reality, we should be receiving sensations from a real outside stimulus. And that can be on our skin, that can be inside our body if it is pain. And in these disorders, what happens? The person is receiving some information, either pain or discomfort, or in this case, Globus Hystericus, the patient is saying, I feel as if there is a lump in my throat, and because of that, I cannot eat or drink. So that is one type of sensation. But if there is any other disorder of sensation, and that is not due to physical disorder, which are closely associated with some kind of psychological stress. So this is related with the psychological distress or psychosocial problems, conflicts, and this leads to the attention and support. So any sensation not due to physical disorder which are closely associated in time with stressful events or problems, or which result in significantly increased attention. Here the person is getting attention for the patient, either from the personal or medical, should be also classed here. Sensations of swelling when there is nothing. Sensations of the movements on the skin. I feel that something is crawling on my skin. I feel that something is moving on my skin, or burning on my skin, or under the skin. And when on examination or investigations we do not find any underlying cause, and because there is some kind of psychological stress going on, and in return the patient is getting a lot of attention and even support, and support can be financial. The person is already not working, or person stops working and wants the benefits and is seeking to get the benefits on the grounds that they cannot function. They have certain sensations which are causing them not to function and do the activities of daily living. There could be simple paraesthesias. Although I'm using the word simple for the patient, they are very distressing. And these are feelings of like tingling and numbness, especially on the fingers, hands. They feel as if they cannot do their function because they keep on having these unusual feelings on their skin or in their muscles or in their joints or in their eyes or ears. Something is not right, whereas on examination there is nothing physical wrong that we know of that could have contributed to that cause, but we do know that there is some kind of underlying psychological distress the person is going through, and in return the patient is getting some support and attention and help from the society or from the loved ones surrounding the person. Disorders such as following should be included, although in my discussion I mainly talked about the globus hystericus, which is a feeling of a lump in the throat causing dysphagia. Dysphagia means inability or difficulty in swallowing or eating, and other forms of dysphagia where it can be that the food is getting stuck at the lower end of the food pipe rather than in the throat, because globus hystericus is feeling of a lump in the throat. Remember, there is nothing wrong. Physical examination, investigations, even x-rays and scans, they have come normal, and no matter how we reassure the patient, the person does not get reassured. Why? Because number one, they're getting attention from other people and doctors, and sometimes they get the benefits, financial benefit. And the other thing is the psychological stress was too severe for the person. It may not sound severe enough for us, but for that person it was bad enough to get into a state where they become non-functional to some degree or extent. The other common, although it's not that common, psychogenic torticollis. So psychogenic means it is region is in the mind. Torticollis is when the neck muscles go into spasm in one direction. So the person is either neck is bent or it is slightly tilted to one side, and it remains in that side for long periods of time, and it is painful. The person can't move. The movements of the neck to look around, to look at the back, becomes really difficult. And it is psychogenic. Why? Because there is some kind of stress going on beforehand, and the person develops the symptom, and person starts getting the attention they were looking for, especially from their loved ones. And there can be other forms. So this is, we have talked about only the neck muscles here, but it can happen to any other muscles, either with the leg muscle or the arm muscle. There could be a spasm, or the person is the elbow is bent, or the fingers are bent, or the fist cannot be open, or the wrist is bent. One or the other form, they go into spasm and they cannot relax it, or they cannot do the normal performance they would have otherwise done it. But remember, we are excluding Tourette syndrome, which is a neurological condition where there can be vocal tics, or there can be motor tics, like movements of the face and eyes or eyelids, or vocal tics like shouting or using the word which they shouldn't be used. So it is very different from that. The other example is psychogenic pruritis. Pruritis means that itching of the skin. And there is no organic cause why this person should be continuously or constantly or repeatedly keep on itching their skin. And we believe that is psychogenic again, because the origin is in the mind and nothing is physical wrong. But we should exclude in these psychogenic pruritis where there could be actually real problems, like there is some kind of alopecia, that is loss of hair going on, or there is actually dermatitis, that means inflammation of the outer layers of the skin, and eczema, which is again inflammatory condition of the skin, where it can be uh, uh, shedding the skin quite quickly and causing the itching and other problems and pain and redness, or urticaria that can happen if you are allergic to some food or medication you take, that a very tiny rash appears on the skin, and they will, if there is no organic cause and if they are psychogenic in origin, even then we shouldn't be including in this. This is purely psychogenic, that there is some kind of psychological or psychosocial stress, symptoms appear, and then the person gets attention and support. The other example is psychogenic dysmenorrhea. Psychogenic again means originating in the mind. This means painful. Menorrhea means periods, menstrual periods. So in this person, the person is complaining that the periods are very painful and they happen every time, and it happens for a long time. Even once the periods are finished, sometimes the pain is there. And we do not find any organic cause. The gynecologists have ruled out any tissue damage, any physiological processes that would have caused the psychogenic, that would have caused the painful periods. So we do not find. So if we do not find any real physical cause, then we start looking at, is there a psychological reason for that? And if we find in these patients that there is closely related in time to the psychological stress or psychosocial problems that have contributed for the patient to behave and present in this way. But in these cases, we must exclude that it is not dyspareunia. That means having pain when doing sexual intercourse, or frigidity, that there is loss of pleasure or loss of interest or loss of activity involving in the sexual activities. The other important one is teeth grinding. Again, teeth grinding can be an organic cause, but in this one, we do not find any cause for the person to grind their teeth. And they keep on grinding their teeth for no apparent reason. However, on exploring, you find there is some kind of psychosocial stress going on. They have fight with a partner, or their partner have left, or their loved ones have died, or they lost their job, or they had some kind of accident or some kind of issues, or other stresses in their environment. And what happens is they don't know how to deal with and cope with those situations, and they keep on grinding their teeth to the extent that there can be problems with the teeth. They keep on going to the doctors and other things, and nobody finds any actually muscular cause for the jaw muscles to contribute towards this, and it can be psychogenic in origin, therefore included in these disorders. Because we believe these problems have arisen because of things in their mind, and things in the mind are causing conflict because of the stresses around the person, and these stresses could be psychosocial, financial, or difficulty coping with the daily stresses of the life, either with the money or with the situation or housing or clothing or getting. So they cause these symptoms, and when they cause these symptoms, the person gets more attention, either from doctors, from society, or from third sector, voluntary sector, or charities, and they get some kind of financial support, they get some attention, love and care, which they deeply appreciate, and the symptoms continue because of the attention they are getting and because of the benefits they are getting, and therefore numbing the pain of the stresses that caused it. And the treatment will be talking therapy, especially the cognitive behavior therapy, to deal with this. If these symptoms are present for a long time, sometimes rather than enjoying the situation, the person may ultimately start feeling quite low in mood. In that case, if they do develop underlying depression or anxiety, that should be treated and investigated. Well, thanks for watching. If you like this video, please press the like button and share with your loved ones. Subscribe the channel for more videos on mental health, mental disorders, especially about identifying the symptoms in mental disorders so that you can go and seek help from the professionals to get the right help and treatment. These disorders can be helped and treated. I will see you again.